Thank you very much. And well, we heard all the promising results, and thank you to Samuel to point it out. Before I joined the lifestyle medicine project we watch, I was 80 kg. Now I'm 72. Thank you all. So this session is about, well, with this promising result, how can we make this a bigger, larger scale to the Hong Kong community? And Terry, you're the key partner. You join us together in the grant proposal preparation. Yeah, from zero to now, and you are in the front line and manage the health coaches. Please tell us, share with us, what is the main challenges or take-home message from the frontline experience? What is the difficulties?
Thank you, Benjamin. Good morning, everyone. It's my pleasure to join this panel and share some thoughts about implementing lifestyle medicine. As we face the rise of chronic illnesses and growing pressure on the Hong Kong healthcare system, lifestyle medicine has become not just an option, but a necessity. As you said, I want to talk about broader view, not just the health coach, because I wanted to talk about the challenges about the Hong Kong. If Hong Kong want to implement the lifestyle medicine, what challenges we faces? First of all, we're also realistic about the challenges because it's really important to recognize and tackle these anticipated obstacles to ensure a good start and successfully integrate this initiative into Hong Kong healthcare system. First up, time constraints presents a major challenge. Some studies show that time constraints are a significant barrier, not just for the health coach or not just for the patients, maybe doctors, okay? In practice, doctors don't have enough time to incorporate lifestyle counseling into their package consultations. So we need to find effective ways to integrate the lifestyle counseling into their pet consultations without adding the heavy workload or to reduce their regular income. May I share some example in some countries are using shared medical appointments. I think that's a good way for Hong Kong as a reference to practice it because it's some research said that it's have a much benefit to the patients and the healthcare professionals. Okay. The second one I want to state is that the issue of staff shortages in Hong Kong. You know, the Hong Kong healthcare system faces chronic staff shortages at all levels. Asking practitioners to take on even more responsibilities without extra support or resources can be a major roadblock. In addition, not many healthcare service providers in Hong Kong have specialized training in lifestyle medicine. I mean, they may not have confidence to deliver these interventions effectively, which limits their ability to implement these interventions. So that's why we need more certified training and education to bridge this gap. To follow this issue, we also need to boost the recognition and support for health coaches in the community. It's important for the public to understand what health coaches do and to build trust in their role. I just give you one example, okay? When we first start this project, some participants were pretty confused about who the health coaches were and what their qualifications were. Some even questioned our team members were really capable or qualified enough. So, you know, the truth is, without trust, the coaching effectiveness could be significantly compromised. So, in the coming days, we need three things: spreading awareness, building the trust, and showing people the value about the health coaches. Thank you.
Thank you, Terry. Thank you. That brings me to my second question is that I would like to hear, for example, from Fiona. I know you are passionate for women and youth wellness.
Yes.
And from your side, from Tin Shui Wai, can you share with us, is there any particular subgroup that embrace, we don't have the trust and issues here, that are already in the beginning embrace health coaching? Or maybe some subgroup that is more hesitated. Can you share with us your experience there?
Yes, thanks, Ben, for this question, which is very good for our team and me as a social worker, indeed. Actually, we are conducting this project in Tin Shui Wai and Yuen Long district in the New Territories West. From our experience in Yuen Long, we actually have witnessed that 3 groups of people are more embracing towards the concept of lifestyle medicine. The first one is women, in particular housewives, or what in Samuel's slides, homemakers. Yeah. So because of the priority in my mind, the homemakers also always put the priorities, put themselves at the end of their priority list. Put their family members, children, or older people, or in front of herself, if for women. So it's about time. It's a concern of time, how they spend the 24 hours of the day. And then we will see, we did observe that the 50 plus, that means early retired people, they embrace more about the project because they may have experienced that they experienced from themselves the deterioration of health or some issue came out. Or you are 72 kg now. So, and then they may have witnessed the situation of their peers or family and friends, so they get more aware. So the third group of people, subgroup, we will say is the underprivileged groups, like in Yuen Long. But we also have the 70 to 30% of female to male proportion in Yuen Long, actually. But the underprivileged class is not that much, not as what we have expected at the beginning. But still, the underprivileged families, they don't have the resources, or they treasure so much the health report and the free of charge blood test from the pre and post blood tests are all free of charge. They treasure so much about having this report and testings to be like the aware, and then to make the change and to sustain. How to make a change for the underprivileged is very important. So I may, for the first group, I may have too simple to describe the first group, women, because we say if women embrace the concept of healthy life, like exercising or nutrition, because actually they are the buyer, they are the procurement department of their own family, right? So if they have the concept of nutrition, a better concept of nutrition, they may be... Oh, the mic is not... Okay, is this one? Oh, sorry.
No,
sorry for
great.
the noisy. So if women embraces a better concept on lifestyle medicine, like nutrition, they may buy better food, more or less the same price, maybe. Yeah, they went to Cafe de Carol or what kind of Tatantang. They know what they can choose. The option is about choosing. So we always say, for us, a Young Women's Christian Association focus on women, if the women in the family have more, be more conscious about healthy lifestyle, the whole family will be benefit. So for the second question of Ben, Professor Ben, that who are the hardest to reach, right? We will say that will be the working adult. In sense of time, because Hong Kong people loves working, 香港人好鍾意返工，係咪？ 返工, going to work is our first priority, huh? Not always about gaining money, but we have to work. But how about our health? And some people may think, like Chinese tradition, maybe if it doesn't break, don't fix it. 冇事咪唔好理佢咯，點解要拎出嚟講咧 I think all these are like cultural myth of Chinese culture maybe hindering how they are engaging in some kind of program and free of charge program about their own health. So, but to tackle, I think these hardest to reach working class people, we can provide more flexi hours of services. Terry may want to beat me up. Flexi hour, like such as us in Yuen Long, my health coach told us that Saturdays is our opening hour. Saturdays is always full of cases because they need to work on Monday to Fridays. So this is our case. So go fighting for the working adult in the next stage.
Thank you, Fiona. Thank you for sharing. You mentioned about the vulnerable groups, and that leads me to my next question to Crystal, my dear colleagues from School of Public Health and Primary Care. I know that you have a similar project. You provide community-based lifestyle medicine to subdivide the flat house person. How do you engage them? And do you share the same challenges, or is there any unique challenges that you face that you want to share with us?
Thank you, Ben. Over the past 3 years, actually, Professor Eliza Wong and myself has been working on another JC-funded project that is on the subdivided flat unit. So over the past 3 years, we have recruited more than 4,000 residents living in these very poorly designed houses. And actually, very similar to what Fiona has shared, actually Hong Kong people really love to work. So basically, this population, they have been struggling a lot in feeding their own family, especially when actually more than 1/5 of them are actually single mother and children. So we are actually taking care of quite many of the very young families with children and also adults living in these subdivided flat units. And another challenges that we have been facing is that actually a significant portion of them are also migrants as well. So not only they are time poor, financially poor, they are also very unfamiliar with the external resources and also social welfare system. So what we have been trying to do in our project that we call them community care workers, we actually provide training for them. And because they are actually previous residents living in these very poorly designed houses as well. So we engage them as a health coach and work with our clients so that they can actually not only receiving lifestyle modification advice, but we are also linking them to the social resources that we are actually having with our two very important NGO partners. So what we are trying to do is very like what Link Worker has been doing in the UK as well, but we are doing in a much smaller scale. And through two different LCT in our project, we actually identify that comparing to just providing care with dietitians or nurses, actually working with community care workers could also significantly reduce the total body fat and also the body weight of these participating families. So I think not only taking reference to the wider middle-aged population, but health coach is also a very promising and also cost-effective model in subdivided flat units and also low SES families as well.
Well, thank you. I think it's wonderful to hear that the social networking is important, how to engage them in the community and link the existing resources. With that said, I want to move to a more macro level now, okay? And I want to ask Dr. Ruby Lai. Health coaching or lifestyle medicine, as we just heard, is not just in Hong Kong. Many places already implemented. With our project, and we know also there are many existing projects ongoing that is related or similar to health coaching. Do you think Hong Kong is ready for this kind of service? And can we do it in a larger scale?
Thank you, Ben, for the questions. I know that like UK, like Singapore, they have been developed lifestyle medicine for some times. But to my mind, Hong Kong just a start. Maybe just this program enlightened me out. Oh, we have lifestyle medicines. Why I don't try for this way of persuading patients to change of their life? But I welcome the development to a greater or larger scale. Because in my daily practice, like Terry said, that doctors are always busy. We don't have time to talk much to my patients. And like I said that people don't think that they need to change if I don't have the disease. Like, they don't think obese or just overweight is a problem. They don't think that they don't sleep well is a problem. But so I welcome the development of health coaching so that I can, so that it incorporate in the clinical service so that we can change my patients have a better and improve and reduce the chance of getting chronic disease. But I do think that there are some limitations. The first limitation is number of health coach. So like this program, we have changed 18 health coach, but it's not enough for a great, a big scale. We have so-called health coach in different private companies, like in Dixie, we said there's health coaching sessions, but I'm not sure their qualification, are they qualified, are they accredited to deliver the health coaching? And they don't have enough time or the intensity to do it. I have talked to our health coach. They have more intense, like every 3 weeks they will call their clients. But like in DHC, the intensity just twice a year or once a year. That intensity is not much reach the effect. So we have to change more. And I let population and let doctor or let practitioner know that they are qualified, and we believe that they can deliver the change and make people change. Another problem is the cost. Like this program, we are free of charge, but it's not sustainable. We hope people willing to pay for the service. I'm searched over the website. I checked the cost of a counseling or session, how much in Australia, in difference, but does our population in Hong Kong willing to pay? They don't realize this service can help them, so they don't willing to pay. I try to refer, I think dietitian in our organization is very much like a health coach. When I persuade them to see our dietitian, I need to pay a lot of efforts. People say that, oh, I'm okay, I can try myself. They just tell me what I need not to do, I will try it. I said that if you get diabetes, it's a lifelong for you. You just take 1 to 2 times or more knowledge, and you can help you for the lifelong. They says, it's okay, I can do it. So if health coaching, even not much concept for our population, I think we have to change them and let them know it can help. Health coaching is a process, and need time to persuade, and need time to get their idea. Maybe I take even 20 minutes in a consultation. I cannot take too much because somebody waiting outside, and I have to wrap up. So if our health coach have enough time, they can make them change. And I have patients have joined this program. I don't intend to call them back, but for others occasion they come to see me. This program have quite a good reputations. They told me that, and they said that their partners, their wife have joined this program, and that can help them, and so they can have some kind of change. It's very good. So I hope it can go greater and incorporate in different service. If we can train more health coach, maybe incorporate in the district's center, and hope that can have a higher intensity and have a better result.
Thank you. Capacity building, very important. And all project we train 18 or such or more, but we need much more. The demand is larger than that. And I think Carmen and Sherry will for sure work closely with the two speakers on to develop a more certificate or transfer-free diploma with a good reputation and recognition, of course. And moving forward, we mentioned a lot about social prescription. So I know, Santi, you have a good experience with that. From your experience of social prescription, how can you see health coach maybe as one of the services as a social prescription? Is it possible? And what was your perspective on that?
Thank you, Professor Benjamin. We run a social prescription, or maybe now we talk about here about lifestyle medicines in our organization by training our youth into a wellness practitioner, or maybe we call them link worker, or maybe a health coach. They are quite similar concepts. Altogether, they just want the patients or maybe the participants to know more about their health and also to achieve the goal of self-health management. So we think about what is the role or maybe the function of the health coach to the whole healthcare system. We try to divide them into 4 aspects. The first one is about empowerment, patient empowerment. We know about the social determinants of health very well. Actually, 80% of our health condition is about socioeconomic factor and also your behavior or maybe your lifestyle. But only 20% of them is belong to the medical treatment or maybe the clinical treatment. So the lifestyle modification and also the behaviors, their patterns of their life is very important. So how to empower the patient to make them to have the incentive to change their behavior is very important by setting the personalized health goal with them. And also, just like Professor Dr. Wong said that, it is their goal, not the goal that we put it on them. So that they have the intrinsic incentive to achieve the goal. And then the second one is about, it is their accountability. So they make their own goal, they are accountable for it, and then they would like to go for it, and they would like to put more effort on it. So first one is about the empowerment. And we found one very important element in that is about relationship building. The relationship between the patient and the health coach is very important. The deeper relationship they have built, the bigger result or maybe the bigger impact we can see. And then the second role of the health coach is about between the gap between medical service and also social service or maybe the community resources. Patients, they believe in medical service a lot. When they have some symptoms, they go to the hospital, but they won't go to the social welfare center or maybe some social service. So it is the role, it is the maybe the function of the health coach to teach them what kind of health service or maybe what kind of social service or maybe resources that can be benefits to them in the society to make a long-term impact. Because sometimes in the medical sector, we want to make a quick impact so that and also the resources in the medical sector is quite limited due to a bigger burden or maybe the manpower shortage. So for the health coach, they can teach them what is the suitable medical treatment for them, or maybe what is the suitable access point for them to go into the medical service. And then when there is a patient or a participant, they are referred by the hospital, we can teach them what kind of community resources that is suitable for them. Maybe take one example from my service. We have a partnership or maybe a collaboration with the Caritas Medical Center in Sim Shui Po, and we ask their doctors to do the social prescription or maybe lifestyle medicine by providing them a referral form. When they have some patient, they cannot find the symptoms or maybe they have a long history of repeating hospital visits. So the doctor or maybe the nurses will ask them, oh, how about you try lifestyle medicine or maybe you try the social prescription. So they will be referred to our center, and our health coach or the wellness practitioner will do the risk assessment, and also the screening with them, and to set the health goal with them, and then to do the motivation interviewing, pursue them to achieve their health goal. So that is the second function of the health coach, to bridge between the medical service and the community service. And then the third one is about education. One of the role of the health coach is an educator, to teach the patient or maybe the participant about health literacy, so that they have a basic level of health literacy, they can monitor and also manage their own health condition. And then the last one is about outreach. Yeah, we know that a lot of medical professions, they have busy work, large workload, so they are stationed in the hospital. So how about we go to the front line or maybe go into the community, then we can rely on the health coach to do the outreach, because they have very similar background. Actually, they are the super connector of their community, so that they know the local resources best. They know how to ask them to go into the maybe service center, so they can do the outreach, no matter do a home visit, ask them and also their friends to join together. So I think that the development of the health coach can be very beneficiary to the healthcare system in these four aspects, like empowerment, bridging the gaps, education, and also outreach.
Okay.
Yeah, thank you.
I would like to continue the discussion of the implementation of the health coaching. So I may ask Gary. I know that CFSC has also operating DXC. No, not yet. Okay, sorry. But what is your view if health coaching can be done in DXC or primary care, or what is the role of NGO in that setting?
Thank you, Dr. Ban. Dr. Yip. During the break, I've been talking to fellows, Dr. Wong. In some sense, the primary healthcare providers in Hong Kong are already practicing health coach, even in DHC. And I want to give you some example from Christian Family Service Center. How do we do? Because I think the health professions from the NGOs are really good at understanding the needs of the clients or the public. And I will give you one example of my own from the user's perspective. I'm the director of this health service, and I had a body checkup appointment a year ago, but I missed it. I really know that I have to do the body checkup because I was supervising a medical clinic, and the main reason behind, I will tell you a little bit later. And I found two coaches for my service. One of them is my dentist, and one of them is my pharmacist. And they gave me two challenges. And the challenges and their coaching brought me through the process. And then I eventually walked to the doctor and do the body checkup. And the first challenge is they registered me to the marathon early in the year. And oh wow, I have a very challenging homework. And during the process, the coach really understood me. I'm a runner. Yes, they kind of understand me that the reason behind why I missed the appointment because I want to look healthy to everyone in my service, right? And during the process, they coach me through the process, training process. They set me up the targets. And the second homework is another marathon in the earlier of the year. And I have to run faster than my first marathon. So they really understand my needs. And the whole process, I ran, I exercised, I did all the, I asked all the questions that I want to ask to my pharmacist, to my dentist, how I can have my diet, how I can have my exercise. And eventually, I walk with confidence to my clinic and do the body checkup. So that's an excellent example, I think. We in some sense, I do believe that in primary health care, everyone in the service should be the health coach. And thank COHK, our service providers, our pharmacists had some certain degree of have some certain degree of training from the certificates, and they learn about evidence-based training, behavioral change, so they really can get to set the really formal training to help with their clients. And I have some inspiration from the program too. In program, the target is really targeting the working adults, and the communication means really changes. We adapt to the communication. We use not only face-to-face, we use texting to communicate, and that's the beauty of the whole program. We adopt the NGOs, the provider we adopt. We really click on the lifestyles of the clients. And for the NGO, I think we can do a little bit more I think the target group is really a good target group for health prevention. And I think we can do more. For example, we target the corporates or in different industries, because in different industries they have different health risks, and that's one of the advantages of NGO. We have different services, and we can know our different area of users very well.
Thank you, thank you. I'm sorry we overrun a bit, but I still have $1 million questions. And that is to Dr. Wong. That is, how can we fund this? How do we make health coaching sustainable? This is the big questions. Some insight, some tips.
Thanks, Ben, for your last debating controversial question for me. And I think most of us are hungry already, so I try to keep my answers short. And from my point of view, as a private solo practice family doctor in the community, I think for the financing, I will agree that we need to have a co-payment from the patients and also from government or other charity or NGO. Because I think if the clients pay the money for the health, it is a gesture of accountability, okay? And however, the amount of payment, that means how many percent should be paid by the client, how many percent should be paid by other parties, and this is controversial. But from my personal point of view, I think 50-50 may be a reasonable price, okay? In Hong Kong, I think not many of us is not having it's not poor. Okay, I think I can say that many Hong Kong people are willing to pay a few thousands for Japanese omakase or a few thousands for concerts. So even spend 100 Hong Kong dollars for a pack of cigarettes per day. Okay, yeah. So I think that for the finance, we need to. One of the challenges that's how it should be paid, but another thing is how we can make it attractive. Yeah. Okay, make the health coaching worthwhile to the clients. Okay, if you can package it as a worthwhile worthwhile activity or worthwhile stuff, then I think the clients will be willing to pay. Okay, 50-50 or 60-40. Okay, so I think this is the point.
Thank you. Yeah, we Hong Kong people, they are not afraid to pay expensive. They want to pay for good stuff.
Yeah.
Right. And I think insurance company can also play a role. Once the health coaching has been recognized, I mean, they actually now fund people to go to gym membership. So what if they fund for you to join social prescription to health coaching? But many things to do, but we are now hungry. So I wouldn't stop it. Please give a applause round to our speaker. Thank you.
Thank you, our panelists.